Okay, thank you for watching today. What I am doing is showing the parents how to do effective wound care management. Most of the time, people are doing wound care after a frenotomy and they're just barely getting the tongue to move. And what happens is most families find that within 48 hours that the baby is not rolling or undulating with their tongue any longer. They kind of feel like it's flicking at the nipple, or when I do an assessment, oral assessment, I feel like the baby's either sliding back and forth, which is telling me there's still some resistance at the floor of the mouth, or they're doing some back humping. So when I go to teach how to do effective wound care, my style is a little bit different than everybody else. So I am showing the parents how to do it on their baby, but I'm going to use the parent so you can actually see the mouth. So I'm going to go in, and if the baby was laying here on the side with their head to my right, because I'm right-handed, I'm going to open the jaw with my thumb, and the baby's gonna cry and the tongue's gonna lift up, and I'm gonna put my finger under the tongue. So bring your tongue a little forward for me, because the baby's gonna be up here. There you go. And I'm gonna put my finger to push the back of the tongue out of the way. Then I'm gonna rotate my finger down on the floor of the mouth. This is the floor of the mouth. What I want to do, because the wound is right here in the floor of the mouth, there's a diamond shape. That's what you're normally going to see. So I'm going to put my finger in the baby's mouth. I'm going to rotate my finger by pushing the tongue out of the way with the back of my finger, and then I'm going to actually push on the floor of the mouth. Then I'm going to rotate my finger 1/4 turn, and I'm going to push back. I'm elongating. Can you feel that stretch? So when I'm doing this technique, what most people are saying, do you feel any stretch at the floor of the mouth when I do this? Yeah. So do you? Yeah, not a lot, right? So when I rotate under, I'm pushing at the floor of the mouth, rotating, and I'm dragging that back. Can you feel more of a stretch in there? Very big difference. So back up to me. What I'm trying to do is get this diamond that they've created. I'm trying to push down at the floor of the mouth and elongate it. So the diamond should become long like this. And instead of what I'm seeing is parents are maybe getting a diamond moving a slight, but I never see this elongated stretch. And the reason why we want to elongate it is when they release the tongue should be able to come up higher to the palate. So that's what we're looking for. We want the babies to extend their tongue up, but also extend their tongue out. So doing this stretch, what I teach the parents, they can now duplicate it on their baby. I always have them practice on each other because most parents are really stressed out about doing the wound care. But when you do it, what I teach is go in, do that nice deep stretch, hold for 3 seconds, 1, 1,000, 2, 1,000, 3, and get out. And that's it for the floor of the mouth.